to the RDH Encore channel. If this is your first time here, I'm Nikisha, Registered Dental Hygienist. And if you've seen my videos before and are a subscriber, then welcome back and thank you for subscribing. On this channel, I share tips and give information on how to improve your oral health. So if you're interested in content like that, please hit the subscribe button and also hit the bell so that you can be notified whenever I upload new videos. So let's get right on into today's video. As the final video in my resolution series, I want to share with you 6 tips to improve your oral health this year. But before I do that, I would like to remind you to hit the like button and give this video a thumbs up if you find this helpful. Also, do not hesitate to share it so that this can be helpful to other people. And also, if you have any questions, please do not hesitate to comment down below, and I'll be happy to answer any questions that you might have. So today's something to smile about comes from Isaiah 26:3, and it reads, "You keep him in perfect peace whose mind is stayed on you, because he trusts in you." Now that's something to smile about. So 6 tips to improve your oral health this year. These are not in any particular order, so number 1 is to get a dental cleaning and checkup every 6 months. So this point is very important for 2 reasons. It allows you to be preventative, and also it helps you to identify problems before they become big problems. And so as far as being preventative, you're able to get your cleanings, you're able to have assessments done on you twice a year. So that, and usually insurance will cover every 6 months. Even if you don't have insurance, it's important to try to get in there twice a year, every 6 months, so that you can get in for your cleanings with the hygienist. We're able to do assessments on your gums, which is called probing. Helps us to measure your gums to determine the overall health of your gums. Helps to point out areas where you may not be cleaning very well so that we can give you instruction on how to better clean those areas so that they don't become a big problem. So you're being preventative rather than being reactive. You're being proactive. You're able to prevent things before they become a problem. During your exam, you would also get x-rays. The doctor's able to go through and look at your teeth, not only just in your mouth as a visual exam, but also as far as taking x-rays, they're able to see cavities between your teeth or any issues that you might have that may need to be addressed. So that leads me into the second reason why it's important to have an exam, is because you catch problems before they become too big of an issue. So by the doctor identifying that you have one small cavity in between your teeth or even on the biting surface of your teeth, they're able to go ahead and do a filling. Now, if for some reason you stayed and without going to the dentist for about 6 years or so, you may have even bigger problems as far as your teeth are concerned. You may have a huge cavity where it's not restorable with the filling. You may need a crown at that point. It may be into the nerve. You may need a root canal, and maybe even the tooth may not be restorable at that point. I've seen many cases where that's happened before. So there's just so many things that can be prevented if you are able to go in every 6 months so that we can catch problems when they're a smaller problem versus it being a big problem. So the same thing is true when it comes to gum disease and having issues with your gums. If you don't go in every 6 months and they're not able to point out any issues that you may be having with your gums and any problem areas, we're not able to educate you and address how to better clean this area so that it doesn't become a bigger problem. And so you may have just a bit of gingivitis, a little bit of bleeding, redness, or inflammation versus having full-blown periodontal disease where it involves the bone and you have bone loss, where that's completely irreversible. So like I said, it's very important to make sure that you get a dental checkup every 6 months. So that's tip number 1 for improving your oral health this year. So tip number 2 is to follow the daily recommendations for oral hygiene practices. So the 2 main recommendations for oral hygiene practices is brushing and for flossing. So with brushing, it's important to make sure that you're brushing twice a day for 2 minutes every time you brush. So that whether that be when you wake up in the morning, you'll brush your teeth for 2 minutes, and then before you go to bed at night, brush your teeth for 2 minutes. Some people get a brush in after lunch or after they eat and different things like that, but as far as the minimum is concerned, it's recommended that you brush your teeth twice a day for 2 minutes every time you brush. So that's for brushing. So for flossing, it's important to make sure that you're brushing once a day, okay? Getting between all of your teeth, and it's recommended that you use regular string floss as your tool for the most part. So by these recommendations, it does not mean that you can't do it anymore, but it's very important to make sure that you are doing these at least a minimum of once a day for flossing and twice a day for brushing. So So by doing this, it helps to make sure that you're keeping everything nice and clean, free of plaque and bacteria, any food impaction in between your teeth. It's very important to keep everything clean. That is the way that you prevent any cavities and gum disease and things like that. So just by following those daily recommended oral hygiene practices, it'll definitely help to improve your oral health. So that's tip number 2. So tip number 3 is to start using an electric toothbrush. So I'm pretty sure that you've heard that using a manual toothbrush isn't as good as using an electric toothbrush, and you're probably wondering whether it's true or not. Yes, it is true. It's definitely, it has been shown that using an electric toothbrush removes up to 21% more of plaque off of your teeth. So using an electric toothbrush it does help to clean your teeth better. So I would definitely recommend using an electric toothbrush. Some people are set in their ways and they don't really like how an electric toothbrush cleans versus a manual toothbrush because that's what they've been using. And you know, that's completely fine as long as you know how to use a manual toothbrush effectively. If you have any questions about that, please feel free to watch my brushing your teeth video, and that will instruct you on how to brush your teeth effectively. But if you're wanting to improve your oral hygiene or oral health this year, I would definitely recommend maybe starting to use an electric toothbrush. Sonicare is my absolute favorite brand. I do have an Oral-B as well, and I do enjoy using that, but if I had to pick between the two, I would definitely recommend Sonicare toothbrushes. Their technology is superb. Number 3 is starting to use an electric toothbrush this year. So tip number 4 is to ditch the plastic flossers. So those little plastic flossers such as Placker's brand or any of the little plastic flossers that are kind of like Y-shaped and they have a piece of floss in between them, I've showed them on many videos. If you've watched any of my videos, you know that I definitely do not recommend these. The main reason is because it just does not clean as well as regular string floss. So you really want to make sure if you want to improve your oral health that you ditch those flossers and start using regular string floss. The regular string floss is just more effective. It allows you to get in, it's more flexible, it allows you to get in between your teeth and gums and wrap around your teeth, your molars and your premolars. All those teeth in the back of your mouth are more round, and so without those plastic flossers being able to wrap around the teeth, they have no flexibility. So without them being able to wrap around the teeth, they are just not able to get in there and get all the plaque and bacteria that's in there. So it's very, very, very important to make sure that you're using regular string floss. Those little plastic flossers, they just don't have the flexibility that's needed. I really wish that they did, because it would mean that more people would be more consistent with flossing every day because it's just easier to use. But I cannot tell you how many times just this year alone already in January that I've spent showing people how, even grown people, 60s, you know, different age groups, how to correctly floss, because this was just not something that was taught as we were growing up, the effective way of flossing, or even how to string the floss, wrap it around your hand, how to navigate it between your teeth in order to remove the plaque effectively. It just wasn't taught. And so I make a point to make sure that each and every one of my patients that come to see me, that they know exactly how to floss, that they've been educated on how to do so, and they also have this outside resource as far as YouTube channel, so that they know, they're able to refer back to it and they know exactly how to use it. So if you haven't seen my video on flossing, please refer, and I'll try to leave a card up here if you'll refer back to that video. If you're not sure of how to use regular string floss, I have a tutorial that shows you how to wrap it around your fingers and also how to navigate it between your teeth in order to be effective and remove the plaque and bacteria that's needed in order to keep your gums and your teeth nice and clean. So like I said, tip number 4 is to ditch the flossers. That's going to do a world of good as far as your oral hygiene is concerned. I have so many people come in that still have inflammation in their back teeth. Those flossers are able to clean the front teeth to a certain extent, but the back teeth, it just makes no difference at all. It just looks like you're not doing anything at all. So do yourself a favor and let them go. It's okay to use them in between meals, but it's just not a good practice to use them between all of your teeth once a day. Use that regular string floss once a day, and if you want to use those flossers between meals, that's fine, but make sure you're getting in at minimum 1 time with the regular string floss. That's going to change your life. So that's tip number 4. Once again, I can ramble on and on about flossing all day because it's super important. So tip number 5 is to stop brushing hard. So a lot of times this happens with people who are using manual toothbrushes because we're able to kind of manipulate those a lot more than we are with electric toothbrushes. So when using a manual toothbrush, as I talked about in my brushing your teeth video, it's important to make sure that you're using something with a soft bristle. So a soft bristle toothbrush, nothing that's medium or hard. Those are way too abrasive for your teeth and your gums. So when you're brushing hard, a lot of times it doesn't matter whether you're using a soft toothbrush or not. You just really want to make sure that you lighten up on the grips. Circles is what you want to do, and you also want to lighten up on your grip and make sure that you're using a soft toothbrush, because if you're not and you're brushing too hard, that can cause destruction to your enamel and your gums, which could lead to gingival or gum recession or toothbrush abrasion. So when you're using an electric toothbrush, a lot of those have a pressure sensor that's built in, so it kind of slows the motor down whenever you're pressing down too hard. So check to see if your electric toothbrush has that feature. That's a great feature if you are someone who brushes hard and you're not able to kind of control that with using a manual toothbrush. Definitely, like I recommended before, maybe switch to an electric toothbrush that has a pressure sensor on it that can help you with that. So that's tip number 5. So tip number 6 is very, very, very important. It may be the most important out of all of these alone. It's very important to make sure that you are just being consistent. Anytime you're trying to adopt something as a new habit, it's very important to just be consistent with it every single day. If it takes you setting your alarm to do something that you don't normally do as a reminder, it's important to do that for a period of time until it becomes second nature. So the biggest thing is just making sure you stay consistent. Set up that dental exam or your checkup appointment. Make sure that if you're able to go ahead and schedule for the next 6 months, then go ahead and do that, to where they can send you a postcard out or call you, or you can already have it on your calendar. That helps you to be consistent. Also, with following the daily recommendations, it's just important to develop some type of routine. If you brush in the morning time and that's the time that you have the most time, then go ahead and floss your teeth, and even use a little rinse if you'd like. And then before you go to bed, if you're just dog tired at night, then it's important to just make sure you're getting that brush in, and then just go to bed. You don't have to worry about the flossing because you've already done it. So just pick a routine that works for you and be consistent. Very important. So I hope you found this video helpful, and I hope that it is able to help you improve your oral health this year. And even if you only start with a couple of these things at a time. Well, that wraps this video up for today. Before I go, I would like to remind you to like, comment, and subscribe. So until next time, everyone, take care and remember to let your smile shine. Bye.